Mr. Wyatt. I'm just washing my hands. I do that between every patient so I don't spread germs. My name is Ashley, and I'm going to be your nurse today. Okay?
Okay.
I'm here to do a short assessment on you. It shouldn't last more than 15 to 20 minutes, and in that time, anything we say will remain private and confidential.
Okay.
Okay. Do you have any questions for me before we begin?
Negative.
Okay. Can you state your full name and date of birth, please?
River N. Wyatt, September 12th, 2006.
Okay. And Mr. Wyatt, where are we right now?
Doctor's office.
Yes, sir. And can you tell me the day?
It's October 3rd, 2024.
Perfect. Can you tell me what time you arrived here?
5:45 p.m.
Correct. I looked in your chart earlier, and I noticed that you lived overseas when you were younger. Can you tell me what year you moved overseas?
2014.
Okay. And what year did you move back to the United States?
2020.
Perfect. Patient is awake and alert, responds appropriately to stimuli, speech is clear and easily understandable, answers appropriately to questions asked, eye contact is comfortable, patient is cooperative and calm, recent and remote memory is intact. All right, Mr. Wyatt, I'm going to give you a series of directions to see if you can follow.
Okay.
All right, I want you to take this glass of water with your right hand, take a sip from it, pass it to your left hand, and then give it back to me.
Okay.
Perfect. All right. Now I'm going to give you 4 random words that I want you to repeat after me. Carrot.
Carrot.
Ankle.
Ankle.
Fun.
Fun.
Tardy.
Tardy.
Okay. Can you repeat those back to me?
Carrot. Ankle. Fun. Tardy.
Yes. Try to remember those. I'm going to ask them later on in the assessment, okay?
Okay.
All right, we took your vital signs when you came in this morning. Your blood pressure was 118/74. Heart rate was 83. Your temperature was 97.9 Orley. Your pulse ox was 98% on room air. And your respirations were 18. All of those are within normal limits and appropriate for your age. Are you in any pain this morning?
Negative.
All right. I'm going to begin with an assessment of your skin. Okay. Your skin color is even and appropriate for ethnicity. I'm going to feel your temperature. Okay. Move your hands for one moment. All right. Your skin is warm and equal bilaterally and with the arms and the legs. Skin texture is smooth, dry, and soft. Okay, same with the legs. I'm going to gently palpate, and I want you to tell me if you feel any tenderness, okay?
Okay.
Is that good?
Mm-hmm.
Okay. All right, no lumps noted, no tenderness reported. Patient has no lesions visible. Mr. Wyatt, do you have any tattoos?
Not yet, no.
No tattoos present. Okay. All right, now I'd like to look at your nails, please. All right. Okay, nails are smooth, no clubbing present, very short. The edges are a little ragged. Do you bite your nails?
Mm-hmm.
Nail beds are pink. The surrounding skin is a little red with some peeling.
Yes.
Especially on the center
Oh, yeah.
of your nails. Okay. Do you chew your nails?
Not anymore, no.
Not anymore. Okay. Your nails are a little dirty as well. Okay. Capillary refill time is less than 3 seconds with both hands. Skin turgor is non-tinting and skin bounces back quickly. All right, we'll begin with the head. If I could have you stand for one moment, I'm going to bring you a little closer. Okay. All right. Okay. Just going to look at your scalp for a moment. Scalp is pale, dry, no lesions noted, small lesions lesion right here at the top of the forehead, next to the hairline. No lumps noted in the scalp. Skull looks normalocephalic. Hair is brown, long, wavy, and evenly distributed. Eyes and ears are symmetrical. Nose is midline with no deviation. Lips are symmetrical. Eyes are in the top 1/3 of the face, and mouth is in the lower bottom of the face. All right, Mr. Wyatt, I'm actually going to have you close your eyes for me, and I'm going to gently touch your face, and I want you to tell me where you can feel it, okay?
Okay. Left cheek,
Okay?
forehead,
Right?
chin.
Correct. All right. Cranial nerve 5, trigeminal, is intact, as evidenced by patient's ability to feel light sensation on the face. All right, I'm going to ask you to remove your glasses for one moment. Okay, I'm just going to, can you clench your jaw for me? Okay, and again. Okay. Patient's masseter and temporal muscles contraction is smooth and even. All right, Mr. White, go ahead and keep your eyes closed. I'm going to try to gently open them, and I want you to resist me, okay? Okay. All right, cranial nerve 7, facial is intact, as evidenced by symmetrical facial movements and patient's ability to resist eye opening. All right, Mr. Wyatt, we're going to move forward to your eyes. Look toward me. All right, I see no drainage or lesions evident. Eyelashes are averted and evenly distributed on the top lashes and the bottom lashes. All right, Mr. White, I'm going to let you put your glasses back on. Patient does wear corrective lenses. I'm going to move about 20 feet to the back here, and I'd like for you to read the smallest line that you can, okay?
Okay. It is EMSPQ.
Okay. Cover your right eye.
BLOUK.
Okay. Now cover your right eye.
AXCHJ.
Okay. Can you read my name on my badge for me?
Ashley Wyatt.
Okay. Patient's cranial nerve 2 optic is intact, as evidenced by patient's ability to read my badge. And 20/20 vision on the Snellen chart with corrective lenses. All right, Mr. Wyatt, I'm going to ask you to focus on the tip of my pen light. Move your fork, thank you. And just follow it with your eyes only, okay? Perfect. Okay, focus on the tip of my pen light. Okay. Now focus on the wall behind me, please. All right, now focus back on my pen light. Okay, and if you can remove your glasses again, please. All right, look my direction. Oh, thank you. I did forget to dim the lights. See if that will work. Okay, thank you. All right, patient's cranial nerves 3, ocular motor 4, trochlear, and 6 abducens is intact, as evidenced by patient's ability to track the 6 cardinal fields of vision. Patient's extraocular movements are also intact, full and without nystagmus. All right, Mr. Wyatt, I'm going to look at your pupils one more time. Okay. Patient's pupils, I'm going to let you put your glasses back on, are brown, equal, round, reactive to light, and accommodating. Patient exhibited consensual accommodation when light shined. All right, let's look at these ears. Patient's ears are symmetrical, no lesions present, they're warm, no piercings. Do you have any tenderness in your ears?
Nope.
Okay. patient's left ear. There is no drainage, foreign objects, or cerumen visible in the outer ear. Ear is elastic with immediate bounce back. Patient's right ear is same. No foreign objects, no drainage, no cerumen visible in the outer ear. Ear has elasticity and immediate bounce back. All right, Mr. White, if I could get you to cover one ear for me, please. Okay, I'm going to whisper a word and I want you to repeat it, okay?
Apple.
Okay, now switch ears for me.
Banana.
Okay. Patient's cranial nerves 8. The vesicular cochlear is intact, as evidenced by patient's ability to repeat whispered words. Mr. White, I don't have an otoscope with me. If I did, I would use it to assess your inner structures of your ear canal. I'd look for any drainage, foreign objects, any other abnormalities that might be present in the ear canal. I'd also use it to shine a light on your tympanic membrane, which should be gray, translucent, pearly. I'd also use it to look at your position of the eardrum and to assess the integrity of the membrane. On that note, I also don't have an ophthalmoscope with me, but if I did, it's a tool used to assess the inner structures of the eye. I'd use that to assess your red reflex, which is when your pupils shine red as a result of a light reflecting off the inner retina. I'd also use it to assess for any opacities of the media. I could look at your optic lens, and I'd also assess any retinal vessels that were visible. All right. Now we're going to look at your nose. Okay. Nose is midline, no deviation visible. If you could remove your glasses for me, I'm going to gently palpate your frontal sinuses. Oh, sorry. You feel any pain or tenderness right there?
Negative.
Okay. What about right here?
Negative.
Okay. It's going to feel your maxillary sinuses. Any tenderness there?
Nope.
Perfect. All right, if I could get you to block one nostril, please, and sniff with the other. Okay. Now, perfect. Nares are patent bilaterally. If I could get you to close your eyes, I'm going to ask you to identify some objects with smell only.
Vanilla.
Okay.
Lime.
Okay. You open your eyes now, and you may put your glasses back on. Patient's cranial nerve 1, olfactory, is intact, as evidenced by patient's ability to recognize objects by smell. All right, we're going to move on to the mouth. Your mouth is symmetrical. Lips are pink, a little dry. Patient has some cracking on the bottom lip. All right, if you could open your mouth for me now. All right. Buccal mucosa is pink, moist, smooth, and glossy without lesions. Open again, please. Teeth are white, present. Patient does have a permanent bottom retainer on the bottom front teeth. Gingiva are pink. No edema noted, no discharge, no drainage. No lesions noted. Open again, please. Okay, hard and soft palate is continuous and smooth. No lesions noted. All right, can you say ah, please? All right. Patient's tonsils are present. Pink. No lesions noted. Graded on a +1 scale. The uvula is midline. The uvula rises and falls midline with phonetation. Cranial nerve 9, glossopharyngeal, is intact as evidenced by the uvula falling and rising midline. Also cranial nerve 10, vagus, is intact as evidenced by phonetation. All right, Mr. White, I'm going to look at your tongue, okay? All right, tongue is pink with some white spots in the back. It's moist, it's roughened by papillae. Look at the underside of your tongue. Perfect. Underside of this tongue is pink, moist, shiny, smooth, with very big veins, visible vessels. All right. Now, Mr. White, if I could get you to stick your tongue out for me, please. Perfect. Okay. Cranial nerve number 12, hypoglossal, is intact as evidenced by patient's ability to stick his tongue out midline. All right, let's look at that neck. All right. You know what? I'm going to ask you we're going to shift your body just a little bit so you don't have to turn your neck. There you go. Look straight at me. All right. You have any pain or tenderness in your? Perfect. All right, I want you to turn your head from side to side, please. Okay, now touch your chest with your chin. Okay, now extend your head to the back. Okay, come back to normal. Now try to touch your ears to your shoulders without lifting your shoulders. Okay, other side. Okay. Patient's range of motion is mostly intact, maybe some slight stiffness when moving the ears to the shoulders. There is no visible or audible crepitus noted. All right, Mr. Wyatt, I am going to ask you to try to turn your head to get some resistance. Okay? Okay, other side. Okay, now try to shrug your shoulders. Perfect. Cranial nerve 11 accessory is intact, as evidenced by patient's ability to turn their head and shrug their shoulders against resistance. The trapezius and sternocleidomastoid muscles are intact and strong. All right, I'm going to palpate your lymph nodes. I'm going to palpate and call them out one by one, and you let me know if you have any tenderness, okay?
Okay.
All right, we're going to begin with the pre-auricular, okay, and the post-auricular, the occipital, okay, the submental, the submandibular, the jugulodynastic, all right, the posterior cervical, the superficial cervical. Now if you could please tilt your head to one side, just a little, there you go. Okay, the deep cervical chain, okay, now the other side, perfect, thank you. Okay, now kind of hunch your shoulders forward a little bit, and then lean forward. There you go. And then the supraclavicular. Perfect. No lymphadenopathy noted. All right, now I'm going to feel your carotid arteries. Okay. All right. If you could hold your breath for me for one moment. Okay, breathe. Now on the other side. Okay. Carotid pulses are strong with regular rhythm and without bruits. All right, Mr. White, now we're going to turn to your chest. Okay. So if I could, I'm going to palpate for tenderness. You let me know if you feel anything.
Okay.
Okay. All right. I'm going to listen to your breath sounds, okay? Lung sounds are auscultated anteriorly, clear, without adventitious sounds noted. All right, now I'm ask you to repeat the word 99, okay? Okay,
99.
again,
99.
again,
99. 99. 99. 99. 99. 99.
okay. Patient, I'm sorry. The tactile fremitus is noted anteriorly. Stronger towards the clavicles, and it diminishes as we get lower. All right, Mr. Wyatt, I'm going to actually feel your skin turgor. Is non-tenting. Okay, pop up. I'm going to actually ask you to turn around for one moment. There you go. Have a seat. Okay, and I'm actually going to lift your shirt for this, okay? All right, patient's skin tone on the back is even and consistent with the rest of his body. Patient does have 4 little nevi here. They're brown, almost like freckles. They feel smooth and flat. Uniform borders, uniform color throughout. All right, Mr. Wyatt, I'm going to ask you, 1 second. All right, take a deep breath. Perfect. All right. Now repeat the word 99.
99. 99.
All right. Tactile fremitus is noted on the posterior as well. I'm going to listen to your lung sounds now, okay?
Okay.
Okay. Lean forward and breathe through your mouth just a little bit. Go ahead. Again. 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 Okay. Lung sounds are clear to auscultation bilaterally on the posterior side with no adventitious sounds heard. Vesicular breath sounds are present in the peripheral lung fields, greater on inspiration than expiration. And patient's spine is midline. All right, Mr. Wyatt, you can turn around now. The last thing I want to explain to you is how to do a breast exam. I know you're a male and this may not apply to you as you think, but breast cancer does happen in men. So one thing you want to assess for is color. Color should be even and uniform with no rashes, uneven skin tones. Those you should report to your doctor. There are 3 positions you should know for your breast exam. You should arms up over your head, back down to your hips, and lean forward. You want to assess for symmetry in your breast in those positions. Any asymmetrical movements, dimpling, puckering, you want to report to your doctor. And last but not least, you should lay down flat, raise one arm above you, use the first 3 fingers of your other hand, and perform a breast exam. You can do light circular motions around the breast. You can go in stripes up and down the breast, or as a wheel, starting from the nipple out. Now your nipple and areola are going to be darker by nature, that's normal, and they should be inverted or everted. Either one is normal. What you want to pay attention for is any changes. If your breast has always been, or your nipple has always been pointed out and suddenly it's inverted, you want to report that to your doctor. Well, Mr. Wyatt, that wraps up our assessment. Thank you for your time this afternoon.
Thank you.